suffer from fibroids and are exploring treatment options to find out which is most suitable for you. Surgery is a big aspect of fibroid treatment. Thankfully, over the last few years, different surgical methods have become a lot more refined to be associated with less complications, easier to perform, and in summary, more acceptable to women than perhaps 20 or 30 years ago. So watch this video to the end, because I'm going to show you the different forms of surgical intervention available for treating fibroids. Hi, I'm Dr. Sylvia. I'm a general practitioner and author and the founder of Askawayhealth, where we provide you with direction and clarity about everything medical. Subscribe to our channel and click the notification bell so that every time we publish a new video, which is once a week on Saturdays, you'll be the first to know about it. For years, we know that surgery has been the main way of providing lasting solutions to fibroid problems and its complications for women. In the past, all women had was either option of removing the womb altogether or trying to remove the fibroid or as many fibroids as they were possible in the womb. This first method that we're going to talk about, hysterectomy, involves removing the womb altogether. Of course, hysterectomy is an invasive procedure, a big operation with potentially long recovery times depending on the process. Because these days you could have a major abdominal procedure where large cuts are made into the abdomen to remove the womb, or it could be carried out vaginally or laparoscopically, in which case small cuts are made into the abdomen through which surgeons can introduce a camera and instruments to use to remove the womb. In some cases, the womb alone is removed, while in other cases, other parts of the organs, reproductive organs, are taken away, such as the ovaries. Hysterectomy is not an option for everyone, usually reserved for women who have, as we say, completed their family, so they're not intending to have any more children. There are quite a few complications associated with hysterectomy, both physical and mental. For example, heavy bleeding during surgery, damage to the abdominal organs, other organs beside the womb. After surgery, the impact of removing the ovaries, if that has been carried out during the procedure. Other complications like bleeding or infections after surgery, as well as the prolonged recovery time, as I mentioned before, depending on which route is used. And of course, there is a psychological impact that this could have on the woman, depending on their background and their culture. So there is a lot to consider, isn't there, if a woman is looking at hysterectomy. However, it is still a form of treatment for fibroids that is used today. So let's go on to the next form of surgery that we're considering. The myomectomy is considered by some to be a minimally invasive approach. It depends on the particular method. Myomectomy simply means that you're removing the fibroid itself from the womb. So that means the womb itself is left in place, but you shell out the fibroid element from the womb. Myomectomy can be conducted using laparoscopic or robotic methods, in which case there is minimal invasion into the abdomen, and we're using instruments inserted into the abdomen through very small cuts to be able to bring out the fibroids from the uterus. So in this case, there is of course less association with complications like bleeding or even infection, and also a reduced time that one has to stay in the hospital after the operation. The third option I want to consider is another minimally invasive approach. It's called hysteroscopy or hysteroscopic morcellation. In hysteroscopic morcellation, a small camera is introduced into the womb in order to visualize the fibroids and help in their removal. It's a simple procedure. The camera helps to direct surgeons to where the fibroids are specifically, how many they are, and helps surgeons to determine the best approach to be able to remove as many fibroids as possible. Usually it's carried out under local anesthesia, so again there's a faster recovery period and less likelihood of complications. While we're on this subject, I'd like to hear from you. What do you think about surgery for fibroids these days? What has been your experience, or what stories have you heard, good or bad? Please share in the comments. The fourth method that we're looking at today is called the focused ultrasound method. So focused ultrasound surgery, or FUS, is an option available for treating fibroids using ultrasound waves. In some areas, it's also known as magnetic resonance guided focused ultrasound surgery or focused ultrasound ablation. And in that particular case, the procedure happens while you're inside an MRI scanner that is equipped with a high energy ultrasound transducer. The MRI gives your doctor or your surgeon the precise location of the fibroid and also shows how close the other organs within the pelvis are, or the abdomen are, so that they can avoid it, which helps to minimize the risk of complications like damage to other organs around the womb. So while the MRI monitors the location of the fibroid and the other organs around it, the ultrasound transducer delivers focused ultrasound waves directly to the fibroid. These ultrasound waves heat up and destroy small bits of the fibroid at a time until most or all of the fibroid tissue has been destroyed by the process. Now, it's a fairly specialized procedure. It's not available generally, so you need to look for certain facilities where this particular method or procedure is carried out expertly. Now, the fifth method I wanted to let you know about today is called endometrial ablation method. Endometrial ablation involves destroying the inner lining of the womb, that is the endometrium, as well as the topmost part or the closest part of the muscle layer to that inner lining. So a woman who wants to consider endometrial ablation should be aware that while it can help to treat heavy bleeding, particularly that's associated with fibroids, it will not shrink the fibroids. The other thing to note that is when you have endometrial ablation, it's important to be on a contraceptive medication and avoid getting pregnant. So the last method I'm going to talk about today, but just briefly, is called uterine artery embolization. It's also a minimally invasive approach, but guess what? I have a full video on this subject. So check the link in the description below if you're interested in that particular method. These are the currently available surgical methods ranging from fully invasive to minimally invasive methods that we have for treating fibroids. So there's a variety that one can consider and make a choice based on what suits you compared to another person. We've done a lot of work on fibroids on this channel. We have a playlist on fibroids, and if you want to learn more about fibroids and other treatment methods that could be considered, please check the link in my description. Put that for you there, and like I said, it's got lots of valuable information that I think could be quite helpful. So if you want to get any more information about this topic, surgical options for treating fibroids, send us an email on info@askawayhealth.org. We'll be happy to respond to you. I'd also love to extend an invitation for you to join our Askawayhealth community. We provide you with regular weekly publications of newsletters and blogs, all loaded with useful health tips for yourself. And as a member of the community, you can also request for us to carry out a video on a topic that you've got some burning interest about, and we'll be happy to do so. So if you want to join the community, we would love for you to be part of us. Subscribe to our channel on www.askawayhealth.org. Fantastic. Thank you for watching. Thank you for spending some of your time with me. If you found this video useful, please drop a note in the comments, say helpful or I liked it. I'd love to hear back from you. Now, please feel free to share this video with a friend or family member, somebody that you think might find this information useful. Subscribe to our channel as well, because that helps us grow and encourages us to make more and more videos like this. So until next time, I hope you have a great day and a great time, and I will see you in the next one.